According to the results of the PRAMI trial, patients with STEMI who undergo a preventive procedure to unblock additional coronary arteries have significantly better outcomes. 462 patients with STEMI and multivessel disease were randomized in PRAMI to infarct artery, PCI alone, or additional preventive PCI. The results of this trial show that in this setting, preventive PCI reduces the risk of cardiac death, subsequent myocardial infarction, or refractory angina by 65%. The TASTE trial is the first large-scale randomized trial of thrombus aspiration for STEMI. Using a novel registry-based concept, the study included 7,244 Swedish STEMI patients randomized to PCI with or without thromboaspiration.
The primary endpoint was all-cause death at 30 days. And the main result for this endpoint was that 2.8% of patients had died in the thrombus aspiration group and 3% in the PCI alone group. We did a trial to look at one of the very important stages in primary PCI, thrombus aspiration. Does this part of PCI save lives? Our answer is very definitive: no, it does not.
ACUT is a randomized double-blind study that evaluated for the first time pretreatment in patients presenting with non-ST elevation ACS and invasively managed. They had to go to the cath lab within 48 hours and preferably within 24 hours.
This study randomized 4,033 patients to either pretreatment with prasugrel 30 milligram or placebo at the time of non-STEMI ACS diagnosis.
There was no benefit of pretreatment, absolutely no hint of benefit on ischemic endpoints. There was an excess of bleeding, which was significant. There was a twofold increase in major bleeding in this patient. So clearly the risk-benefit ratio is in favor of having the drug in the cath lab once the coronary anatomy has been defined and when we are sure that PCI is needed, and not give the drug systematically to the patients before they get to the cath lab.
ESC Congress 365 is your free access to ESC Congress content all year long.